We want to talk about early signs of cervical cancer that you shouldn't ignore. Now, wetin we want to talk about today. Researchers then get and say before women they die because of this sickness. A lot of women, but these days the death rate it don't still reduce. Why? Because women they notice them, they don't see the signs, they don't know the signs. So when they see say some things like this they happen, they will go meet doctor. Doctor will tell them. Una no say I dey always tell una for my channel, just go and see your doctor. All these signs where I want give today, if you dey experience all these signs, go see doctor for scanning. If it be say na cervical cancer, if it be say no be cervical cancer, but all I just want us to do is to go and check. Number one for my list today now, lower back pain. Yes, a lot of women they suffer this thing, say lower back pain. Yes, this picture where they show for screen. So if you dey feel pain for this position every time and the pain they come, you know they gree go, yes, go for checkup. Go and check. If it be say no be even cervical cancer, if it just be say na muscles, now something to do with a muscle pull or tear or any other thing, you know, but to come out of this deadly disease, make you go check today on the safer side. Then number two, na leg pain. Yes, this part of leg where they show. So if you dey feel pains for all this region of your leg and it constantly you can't feel that back pain, then feel connect to make you go check, make them do the scan if na cervical cancer or not be cervical cancer. Number three for my list na pelvic. Yes, pelvic pain. This place where I show for my screen, so na im be our pelvic region. Yes, if you dey feel pain for here, it means say the tumor, that's the cancer, it don't grow. Now it make the pain come out from there. Not be still waiting bad. You can still go. They can still check it for you, scan it for you. It might just be ordinary PID, where they call them pelvic inflammatory disease. Yes, if it still be say na cervical cancer. Number four, na loss of appetite. Yes, you go just day, you know the sick, nothing they do you, but food not they hungry you. Why that? Go and check. Why I dey lost appetite? Why food not they hungry me? Go to your doctor, then go do the best position to do the necessary test to tell you if it's a cervical cancer related symptoms. Now be that. Then number five for my list now, weight loss. Yes, that one they go say is understandable. Person will not they eat if they lose weight. But if you can't lose weight drastically like that, go and check. Why am I losing weight? Number six, na abnormal vaginal discharge. If una don't see my video on abnormal discharge, una go understand this one way I dey talk. So because a lot of discharge they come out from our body, but when it go come, they smell. Yes, and it can't be like say it they mix with blood, and it can't be like say the kind thing where they come out from there, then they thick. You know, go and check. You don't watch me reach this level, you never still share me out. Share me out, share the video. You might be helping someone down there where it be say he get all these symptoms for body, but he don't know what they mean, or they don't even get the symptom. Once the video reach out to them, they will know what to watch out for. Longer and heavy period. Normally our period not supposed pass from 3 days to 7 days. If it's too much, if it can't pass there, you know, too, they okay, not be waiting to write, but go and check. If it just still be say now another thing cause something like fibroid, if it still be say now this cervical cancer where we talk about, so now it's the cause. But make me and you for no the doubt, I been at this, I been not be this. That is why it's good we go and check. Pain during intercourse. Yes, pain during baka boko. If the thing they pain you well, pass the way you dey enjoy them, and maybe not be so it dey pain you before, go and check. If it just be say na kyst dey, if it still be say na this cervical cancer, and after una don't do this baka boko finish, you go come see say when you clean, small blood must come out. If it be say na cervical cancer, if it still be say no be cervical cancer, because some women when they use a contraceptive, then they experience this kind of thing. If it still be say na contraceptive wey then they use, na it still cause am. But make you for not fall victim, go and check. Why am I bleeding after sex? Then another one, now bleeding during menopause. You know they menstruate again. All of a sudden, you go constantly see blood. Yes, now that one that they call am red flag. Yes, red flag. Now then they call am medically. Waiting that word mean now make you run, make you go check why you dey see blood again. After you don't rule am out, say mesis, it don't finish. Now very dangerous situation be that. Yes, don't auto-diagnose. Just go and check. Why am I bleeding? You know, another one can be bleeding between periods. Yes, maybe your mesis don't finish 4 days. Another 15 days again, you can't see am. 30 days again, you can't see am. No be say it is, no be say na bleed, no na normal mesis o just stain in between mesis. Before you see your next mesis, you go stain between those days. No be waiting correct. Go and check. Bleeding between periods might be sign of cervical cancer, and if it be say not be even sign of cervical cancer, but go and check. My sisters, now here I for end this video today. Una know say I dey always dey talk and say health is wealth. Always seek for a medical advice. Guys, I see you all in my next video. Bye-bye.